and Lord Almighty to allow me to share the days with my own teacher, Dr. Pallav Ray. And I'll just tell you one thing, very important thing about this gentleman who's standing here. See, a mediocre teacher tells, a good teacher will always explain well. A superior teacher will demonstrate simultaneously. But a great teacher will always inspire and will continue inspiring throughout your life. And such a teacher is Dr. Pallav Ray. He has profound depth of knowledge of microbiology as a senior professor in the Department of Medical Microbiology at PGI Chandigarh, and he is a teacher of teachers. He has taught all of us, and what we are today is because of him professionally, and I owe everything to him today. So I consider myself very lucky today, to have shared the stage, sir, with you. And as usual, his words will always be like droplets of pearl in the ocean. So he's going to tell us the story of microbiome in health and disease. And I request all of you, to listen to him. You will find it so beautiful and so wonderful, the story of microbiome, the gut microbiome. And I'm sure sir will lead us to a beautiful journey. I welcome sir, and I request all of you, let us all join together and welcome sir today for this talk. Thank you, sir.
Thank you very much. Dr. Jharna has made me emotional before even I could start talking.
I myself have become a
Okay. And she has rightly told that I'm not going to talk about, difficult names of microorganisms and drown you into, names which are very difficult to even pronounce. Rather, I am going to tell you a story about how microbes and human beings are intricately related to each other, and therefore, I start my presentation on human microbiota in health and disease. And before that, I take you back to a statement that microbes came, so we came. You know that the earth originated about 4.6 billion years back. That's when the earth started. At that time, the earth was very hot. We didn't have any oxygen in the environment. It was being bombarded with meteorites. And it took about 1 billion years for the earth to cool down sufficiently so that other things can actually evolve on earth. And the first life form that evolved were prokaryotic organisms, the bacteria, definitely anaerobic, because there was no oxygen in the atmosphere. These prokaryotes gradually evolved into something called cyanobacteria, blue-green algae we call them. They are not algae, they are actually bacteria. And these bacteria, they had a mechanism similar to photosynthesis in plants. And thereby, they could gradually fill up the Earth's atmosphere with oxygen and pave the way for other higher eukaryotic and all these other life forms to evolve. And finally, we human beings are here for maybe a couple of 100,000 years or so. So a few things come out of it. The first thing is that, out of the complete history of Earth, the first half of the history of Earth, we didn't have oxygen on Earth. The second thing that comes out is that the first 2/3 of the history of Earth, the Earth was exclusively a place for microbes. And there were hardly any other life forms on Earth. Third thing is that we owe our life to microbes. We are here because they came first and paved the way to evolution of all the other life forms. And therefore, we cannot complain that the organisms, they have actually invaded us and they are causing nuisance to our body. We have invaded a world which was exclusively belonging to them, right? So we can expect that our whole body will have multiple microbes on the body, inside the body. Now, residential microbes in animals performing metabolic functions, it has been known for nearly 500 million years. And if you take a conventional mouse and take a germ-free mouse and analyze their plasma, you will find that the conventional mouse has lot more chemicals in its lot more chemical molecules in its plasma as compared to the germ-free mouse. And all these chemicals which are present in a conventional mouse, absent from a germ-free mouse, they are actually contributed by the microbes they host within their body. So microbes are contributing to our body for a long, long time. Okay, now we can easily expect that we have a microbiota which invades, which is present in huge numbers on our body, inside our body. And then you will see that during the pre-H2S, that means era, this normal flora that we call, that was like a black box. It was mostly dependent on our experience from microscopy and culture positivity. And gradually the whole concept changed, and after changing the concept, now our concept has changed a lot. Earlier, if you ask somebody what is the most common organism present in our gut, can anybody answer? What is the commonest organism present in our gut? Yes, I expected E. coli. Now I tell you that anaerobic organisms, they are 100 times to 1,000 times more than aerobic organisms in our intestine. How can E. coli be the commonest organism? Cannot be. So it has to be an anaerobe. And truly speaking, after the sequencing era has come, we now know that the Clostridia are the most common organism in our intestinal tract and not E. coli. So our understanding has changed a lot. You have already, Dr. Vitul Gupta's presentation, you have heard these terms. We use the term Firmicutes. It's actually a phylum. Firmicutes means tough skin. So organisms which are gram-positive, they have a tougher wall, so we call them Firmicutes. Remember, Firmicutes means all gram-positive organisms. We use the term Bacteroidetes, which includes most of the anaerobic gram-negative organisms. The third phyla we frequently mention is Proteobacteria, which includes most of the common garden variety of gram-negative organisms. Okay, so these terms we'll be using more frequently. Now, I will give you another small concept. You know that our body has about 10 raised to the power 13 cells, and we have at least that number. Some people say 10 times that number of microbes in our body. Now, I ask you one question, that after the human genome was completely sequenced, we found that before that, Drosophila melanogaster, which is the fruit fly, 5 millimeters in size. So we found that it has about 17,000 genes. Looking at the complexity of the human body, if I consider that, then we have to think that we must be having at least 100 times that number of genes to account for the complexity of the human body as compared to a fruit fly. So when the whole human genome was actually sequenced, we found that we have only 20,000 genes, 15% in addition to what fruit fly has. So now you know that truly speaking, the number of genes cannot explain the complexity of the human body. And today we know that the whole complexity is because of not the human cells additional genes, it's because of the genes which are contributed by the microbes which are present in our body. The human body has intelligently outsourced many of its functions to the microbes so that they perform it for the human being. So they are present in our intestine or our skin and working for us, and we are hosting them in our own interest. Okay, so I'll skip these. So you can see that with the understanding of all these facts, the number of papers in human microbiota, they are skyrocketing since the early part of this century, and there was a big boost from 2010 onwards. Okay, so I will skip the development of microbiota because Dr. Vitul Gupta has already talked about it. I'll directly go to the functions of microbiota. So right now, as Dr. Vitul Gupta has said, that largest organ in human body is microbiota, not the skin. So right now it's believed that microbiota is the largest organ in the human body. Okay, Now, microbiota in a healthy gut, if you look at the healthy gut, we have two types of organisms. We have a GIT surface area of 300 square meters, colonized by nearly 10 raised to the power 13 to 14 organisms, the whole GI tract. And this GI tract, it sees about 60 tons of fluid passing through it in our lifetime. And that actually modulates the microbiota. And you will see that the microbiota in GI tract, it is unevenly distributed. That means the count is lower in the upper part of the intestine and gradually increases as you go lower and lower, highest being in the colon. And it varies anatomically from different parts of the, from one part of the body to another part of the body. You can see the different groups of organisms, they show a lot of variation from one part of the body to another part of the body. The functions, Dr. Vitul Gupta has already told, so I'll rapidly pass through it. So metabolism and nutrition, I mean, it salvages many of the things that human body is unable to digest. You know that we cannot digest complex polysaccharides which are present in plants. We cannot digest cellulose. We cannot have ghas ki sabzi. Then probably many people won't have gone without food. So, but many of these polysaccharides, the microbes that we have, they can break it down and break it down to what is known as short chain fatty acids, which provides nutrition to our epithelial cells. It also has anti-inflammatory activity, and it also has immunomodulatory activity because it enhances production of T regulatory cells and T helper cells. So therefore, and it, the gut microbiota also provides protection. It provides immune ability to our body because many of our T cell functions, their maturation depends on the gut microbiota. I won't go into those details. There is one particular organism, unclassified. It's called segmented filamentous bacterium. This bacterium is responsible for maturation of T regulatory cells as well as T helper cells. So if it is not there, they will have immune deficiencies. Gut-brain axis, Dr. Vitul Gupta has already mentioned. I don't know who coined the term gut feeling, maybe hundreds of years back. He had lots of vision. Now we know that our gut decides what should be our feelings, and our feelings decide what our gut should be, how it should function. And truly speaking, tomorrow if somebody comes with an abdominal upset, if I say that aapka dimag kharab hua, so he will get offended. But if you really look at it, the amount of neural tissue we have in our gut is now compared to our brain. Nowhere else in our body we have such kind of an intricate neural network. That's why nowadays the gut neural tissue is called the second brain of the body. So we have one brain in the head, we have another brain in the gut neural tissue. So I'll skip the gut-brain axis and other things. I'll directly go to, okay, one word about antibiotics. Be very careful with antibiotics. They have a devastating effect on the gut microbiome. And if we believe that it's true that so many, our even immunity depends on the organisms present in the gut, killing those organisms as a side effect of trying to treat another infection automatically gives us lots of hindrances. We have to always try to preserve the gut microbiota as much as possible while thinking about antibiotic therapy. I won't go into details again about all these things. Coming to the microbiota and disease link. Okay, I have only 7 minutes, so I'll rush through it. You know that microbiota have been linked to most of the diseases that you can even think of, starting from brain disorders, autism spectrum disorder. If you find time, go and read one article in Science. It's a 21-page article where the scientists, they have created a mouse model of autism, and they have treated the mouse simply with Bacteroides fragilis, and they have reversed the autism disorder in the mice. and they are claiming that autism is because of a gut microbe alteration, and it's not really because of a primarily neurological disorder. Similarly, we have schizophrenia, bipolar disorder, neurodegeneration, all have been related to gut microbiome. Respiratory diseases, COPD, asthma, cystic fibrosis. Asthma, many of the allergic disorders, they have been linked to the microbiome. Nowadays, we have a habit of creating a kind of a sterile environment and living into it. I know about one of my relatives who buys Bisleri water, then boils it, cools it, and he gives it to his children to create a virtually sterile environment. In that way, we are actually preventing the helpful microbiome to establish into our body, and thereby we are actually diminishing our own immunity. Truly speaking, when in the initial part of our life, within the first few months, when the immune system is naive, the amount of exposure to different antigens of organisms makes our body tolerant to those antigens. And if we prevent them from coming to our body, and they come later on when the immune system has already become robust, then it produces hypersensitivity and allergic type of diseases. That's what is called the hygiene theory. Similarly, we have inflammatory bowel diseases, cancer, metabolic diseases, periodontitis. So all these diseases have been linked to the gut microbiome, which is primarily the gut microbiota. In case of skin psoriasis, atopic dermatitis, acne, chronic skin ulcers have been related to the microbiome. And then we have, say, gastric microbiome. Helicobacter pylori presence or absence decides what kind of microbiome we'll have in the stomach, and that also decides about acid peptic diseases, malt tumors, adenocarcinoma, reflux esophagitis. It has been related to that. Now, chronic G diseases, already Dr. Bitul Gupta has already talked about it, so I will avoid it. Obesity, I won't go into details. Colonic cancer has been related to an imbalance in the gut microbiota. Liver diseases, the non-alcoholic fatty liver disease has been related to the gut microbiota. You can read one of the very recent papers where they have shown a particular strain of Klebsiella pneumoniae which can convert carbohydrates into alcohol, thereby it can injure the hepatic tissues. And truly speaking, a person like a teetotaler like me can have actually internal production of alcohol leading to damage to my liver. So, ethanol, it causes, then atopy allergy I have already referred to. There are so many other diseases, cardiovascular diseases. We have the metabolic syndrome, diabetes mellitus, hypertension. They have been already related to the gut microbiota. Now, I will end up my presentation with a few statements. First, we know that we have many diseases on one hand, and we have altered microbiota on the other hand. We do not know which one is the cause and which one is the effect. Is it that the microbiota is causing the disease, or is it the disease is causing an altered microbiota, or is it there is a third factor which is affecting both the disease and the microbiota together? So, I mean, simply an association does not say that there is a cause and effect relationship between the two of them. We have to be very careful in our conclusions. Microbiome analysts, they are largely observational and associative. So we have to follow the criteria like the strength of association, consistency, specificity, temporality, biological plausibility before we can decide that what is actually causing what. Second, a very important thing, you have probably all of you have read about Koch's postulates. Koch's postulate says that for every infectious disease there has to be association with one organism. So you have to repeatedly isolate that organism from all the cases of that particular disease. When you inject it into animal models, again you will create that disease. Again you can re-isolate the organism. So Koch's postulate is based on single organism associated with a disease process. Now the understanding of microbiota, it is telling us that it's not true in all cases. There can be the simple alteration of the different components of the microbiota which can cause a disease and not a single organism itself. And it has been proven beyond doubt at least in two conditions. One is bacterial vaginosis and second is inflammatory bowel diseases. In both of them, we do not have one organism as causative organism. Rather, we have an altered microbial distribution or dysbiosis which is causing the disease. Okay, I'll avoid all these things. I again repeat the statement that Dr. Vitul Gupta has said, that all disease begins in the gut. It was told by Hippocrates 2,400 years back, and now we are starting to understand that there may be truth in that statement. I will end my presentation with a poster which was given in Nature in 2011. It's saying that the child is saying, stop the killing of my beneficial bacteria. Do not kill them. I need them for my health. I need them for my survival. Therefore, protect the good bacteria that we have, and it should be a call to action. Thank you very much for your kind attention.
Thank you, sir. As usual, such a beautiful presentation, and there's nothing more that I can add. He's probably given everything, and he's elaborated so well on every single aspect of how the microbiome is linked to disease as well as to health, and the protection, how immune system is developing from a child, I mean in its infancy to its adulthood, how the microbiota is playing such an important role in driving the T-cell based immunity. I open the talk for any questions to the audience. Yes, madam.
Thank you, Dr. Pallavre, for a wonderful talk. I think you are right that nothing can be added. Only I can say there's this flora concentration of bacteria in different parts of GIT. We can measure by doing the lactulose hydrogen breath test, and that can show if a person is taking frequently antibiotic and he says I have not taken, but that test can show that you have taken antibiotic if you have taken within a month. It is reported in the Western country that in their population the normal flora comes up in 15 days after taking the antibiotic, but we have seen in our population it takes about 1 month. And that can show what type of diet you are taking. If you have taken more of carbohydrate, like Dr. Pallavre has said, the people who are taking 4, 5, 6 chapati in it at a time, they are having more bacteria in their large intestine. And we can show that the person is having normal flora or not, concentration. The concentration of bacteria is there or not. So that is a non-invasive lactulose hydrogen breath test. By just taking the end expiratory breath, measuring the hydrogen, you can tell.
Can I make two comments on this? I mean, the first of all, the right part of the colon is known as the fermenter of the body, because we have more of carbohydrate degrading organisms in the right part of the colon. The left part of the colon is known as the putrefactive component of the body, because that has more of organisms which break down proteins. So this is one of the things. Secondly, do not be, I mean, the understanding of microbiome is in a very nascent state, and most of the pharmaceutical agencies are exploiting it by providing us in the name of probiotics many of the formulations, and we are carried away by it. Truly speaking, we still do not know whether the organisms they are providing, those organisms can actually revert any disease process in our body. There is a recent publication, are we fooling ourselves by accepting those preparations in the name of probiotics? So do not have a blind faith on probiotics are always good. We still do not know, we have to know a lot more before we can conclude that.
It's a wonderful talk, sir, from the Big Bang to present day. And I would like you to tell me what's your take on vegetarian food versus non-vegetarian food. Which which would be the better one, which would give us the better microorganisms and microbiota in the gut. And and
Well-
secondly about yogurt like curd, and which are the natural probiotics and which are available these days, like in natural foods. Which are your take in which ones we should take?
It's very difficult to compare the two, and the amount of literature available on it is not necessarily an honest literature. They are on many occasions it's driven by people with different kinds of interests in it, even pharmaceutical companies. But definitely what we know is fiber-rich diet, which is more commonly found in vegetarian diet, has got a much better effect. They are actually prebiotics, different fibers. They have a better effect on establishing our stable microbiota as compared to a diet which has very little fibers. So that much is very clearly known. Recently you must have seen that there has been quite a bit of controversy arising out of red meat, because it was always considered to be very bad for health, and recently people, they have started talking that red meat is not after all that bad. So I mean, you never know, you cannot take those statements on a face value, and I mean, we still do not have the final answer in all this.
Microbiota and obesity.
Well, there are very well characterized and well conducted experiments. One of the experiments Dr. Vitul Gupta has already referred to, where from obese mice the microbiota were fed to notobiotic mice, and from the lean mice the microbiota was fed to notobiotic mice, and those mice which were fed with lean microbiota, they remained lean, whereas the obese microbiota became obese. So that shows that there is a direct correlation between the microbiota of obese people and obesity. So, and there are many other studies which are now giving us better understanding that probably microbiota has got something to do with obesity. That probably gives us the fact that don't blame me if I'm obese, it's my microbiota to be blamed, not me.
If there are no more questions, we can carry on to the next lecture by Dr. Y.K. Chawla, who doesn't need any introduction because he has been the director of PGI Chandigarh, director academics of KIMS Bhubaneswar, and he has special interest in hepatitis B, C, portal hepatitis.